The Skin Research Center has been around for about a little over a year now. It's a significant investment by the Hull York Medical School, and the goal is really to be a world-class research center that focuses on improving patient care through science. And the way that we do that, I think, is through commercial outcomes. So developing new intellectual property, let's say inventing a device or a technology, and then commercializing that out into spin-off companies or licensing it to other companies. And the other way is through interacting with the NHS and the healthcare system here.
Within the context of the NHS Trust, I've been a consultant dermatologist for over 25 years. I'm a general dermatologist, but spend a lot of time working on skin cancer, which makes up about 50% of our workload at the moment. But I'm also very keen on androgen-mediated disorders and women's health. Skin problems are incredibly common. Look at them globally. About a third of the worldwide population will get a skin disease at some point. One of the biggest things with skin problems is the impact they have on patients psychologically and socially. One of the things we'd like to do with skin disease is make sure that everybody actually has access to good skin facilities. So actually trying to increase the profile of skin disease and actually research into skin disease and try and understand what are the problems to our patients so that we can translate those into research and answer questions that are important to those patients is really critical.
In the skin research field, particularly in the UK, what we find is that innovation doesn't always lead to commercialization and patient outcomes. So we have expertise in things like skin cancer, skin aging, microbiome, wound healing, and infectious disease, immunity. So highly trained people in these particular areas that make us quite unique. And what we find is that we have a few cross-cutting themes, few cross-cutting technologies and things that we do better than anyone else in the world. And when we apply those things to particular diseases, that means we can make step change improvements, not only in what we know, but how to roll out things to the population at a large scale.
I think one of the benefits of the Hull York Medical School Skin Research Centre is actually having both a base in York and in Hull, because we've got some fantastic scientists in both camps. We've got clinical trialists in Hull, we've got health sciences in York, and I think that's going to bring together disparate groups which are really important to us. My role is to develop an academic clinical base, delivering research studies for the centre and supporting some of the scientists in some of their early career research and also the young clinicians in their early career research.
Having local industry involved is something that we didn't have in Australia when I was there for the last 15 years. Having that at the doorstep here, it's not only a catalyst for great research and great publications and great output, but it also means that we get industry input into what we're doing that's local, that's relevant, that means that we can now build on those types of relationships and make them even stronger with the two universities instead of just one. So that, in combination with the international industry that we're already connected to, means that, yeah, we can do so much more with international and local industry engagement than we were ever able to do before. And that's an area that I see the University of York and University of Hull really growing at the moment.
We're in a very fortunate position. We've got absolutely fantastic scientists, clinicians and technology facilities. Suddenly we've got this opportunity to look at synergies and work together collectively. And I think that's really important and something that I think makes us quite special as a skin research centre.
We've had phenomenal support from the university, from the medical school, and it's just made a huge difference. So for me, it's incredibly fulfilling, and we're moving at a pace that I've not seen a skin research center move at.